When you get your bearings. When you get your bearings, whatever you
Well, what we try to do is help
so that would help stimulate. It's basically tied into the grant challenge. Some of the sea grants that you
And like the discussion in charge of education.
Yes, I told her a little bit about the two guys. What was your name? Manesh. Okay, good.
That you cannot make, or you may want to.
So Sarah, we got just got
Okay, so let me. Okay, thank you so much.
Thank
so
you.
The only person missing is Adrian.
Yes.
Okay. all
And
right.
that's what we're going to wait until they come. Okay?
Great.
Second one. Yeah, I know she's very. Yeah.
All right. Well, Tom's in charge. Then Tom.
So why don't you yeah, we need Wayne and Sebak.
Eric, where's Sarah? We forgot Sarah. Okay. Sarah's going to sit right so you can see everybody. You see it's right in the middle and you can see everybody. So like Eric? And pick him and listen. And add next to close to add if you want.
Evgeny's going to say a couple of words.
looks like that.
Oh, okay. Especially you have to sing.
Yeah, there is a two.
Keep them to this way. Okay. So, Corinne is on the seat. All right. And then I'm going to keep this for Adrian, the assembly member, when he walks in, so he can sit right there. Okay.
So welcome to our distinguished guests. We have many distinguished guests. Council Shakarian, thank you for joining us. Vice Chancellor Karagosian, thank you for joining us. Just assumed your new post as Interim Vice Chancellor for Research. We're glad to welcome you to that. Dr. Eric Israelian, the Chief of the Division of Infectious Diseases, and to Aaron Najarian, the Mayor of Glendale, soon to be on the Board of Supervisors of the county. We welcome all of you to this really wonderful event, and a special thanks to Mrs. Pitchian for joining us and for making all this possible. We really thank you for your generous gift that allows this collaboration to happen. Thank you very, very much. This is the signing of a memorandum of understanding between the Regents of the University of California on behalf of its Los Angeles campus and ArmGenia Genetic Research Charitable Trust in Yerevan, Armenia. And this formally establishes an important collaboration that we hope will grow and continue. We at UCLA are very proud to partner with many institutions around the world. We think it definitely enriches our activities here, our education, research, and teaching activities. And this is especially important because of the large Armenian community here in Los Angeles, and we really are happy to join with you in making this happen. Before we sign, let me ask Dr. Avakian to say a few words. And
Well, thank you.
yeah,
It is a pleasure to be here with you, and I thank you to be around and share with us this very important and cheerful moment. Just a few words, an historical overview of how we end up close to the signing ceremony, signing this paper. Well, UCLA has a long and fruitful history cooperating with Armenia. I can mention the nursing project that for years goes on in South is very instrumental in that. And now we have the nursing school that produces high qualified nurses, and the system is very happy with that. So every head doctor is fighting for those graduates. I met Dr. Ishiyama. His name is very famous back in Armenia. Everybody knows him very well. Started from the Ministry of Health, ended up with every ENT doctor. So they've done a great job. Almost more than 100 people got their devices. You know, now they can hear, they can watch CNN, wonderful thing. And now here we are. And the project started from the idea of Eugene Sakurenko, an Ukrainian descent. Very important issue. His wife is Armenian. It's always the case when you have an Armenian wife, you have to please her somehow. Although most importantly, his wife is my sister. So he brought up the idea to do this genomic study or map genetically the Armenian population, although some researches back in Armenia were performed already via Y chromosome, you can see in the brochure that I have handled, and maternal DNA, but nobody has done whole genetic there. And we can't do it because we don't have the expertise, we don't have the facilities. It's a high-tech thing for us, and that's when we get into a situation like that, it's problematic. We knock Salty's door to say, so we can help us out with this. Are there any people at UCLA who deal in genetics? That's how I met Dr. Brody Wang. Yeah, it was our pleasure, like 1.5 years ago.
Yeah, it was a while ago.
And it was, a brainstorming meeting, and then we decided to do something about this. So we established the organization, which is a non-profit charitable organization back in Armenia, and started looking for funds. That's how we have the chance to have Ms. Sara Chichan. And this name is very popular in Armenia, because you go to the American University of Armenia, you can trace the name there. You go to the Museum of Genocide, it's over there, and I was lucky to be the director and see the 8th edition translated into Russian of your dad's book, Genocide Survivor. Here's the book.
Let everyone look at it.
Yeah, so we're gonna, ask you to do the whole genome typing of Ms. Chicha, so we can see what is this mutation that makes her to donate.
And then we'll clone it.
And maybe we can activate later on,
Yes.
so she can give more, kind of, or find other fellow Armenians that have the same genes.
Yeah.
Promote this project. And anyway, it is our pleasure to be here, and we are happy, really happy. And our friends and founders and in the medical field and scientific field are looking forward to us to come back with this piece of paper and start the cooperation in this field as well.
thank you very, very much. Thank you very, very much. Dr. Sakurenko, would you like to say a few words? Since you are the co-founder of this project.
Yeah, it turned out to be a nice family business. Indeed, I approached Slovakia myself, studying a lot of genetic variations, and as a scientist, I told Slovakia, there's lots and lots of nations trying to do this genome projects, studying this Islandia fest and so on. But I think why not to do Armenians, you know, and with Slovak expertise already accumulated in many areas. I said, you know, it will be great. I think Armenians are proud people. They would like to be genetically defined. What I was surprised, however, when we decided to do this, more we were thinking together with Siva, more fascinating the project became, and it's very clear became that it will be very unique project, very unique, considering how Armenians are actually truly how separate they are on the branch of human or populations, how dispersed they are, what a history is, how well we can accomplish so many things from both medical perspective, historical perspective, educational perspective. It absolutely became a unique project. I don't believe any other nation, if decide to do something like this, would be able to accomplish that level. So I'm very happy to be here, and happy that my brother-in-law supported the idea and started wonderful leading it. And thank you very much for everyone who comes.
Thank you. Dr. Grody.
Yes, well, thank you. This really is a wonderful event, and it is really like a family. I feel that way both locally and globally. If not, just to start out, Evgeny, who I was so happy to meet, is a professor at the University of Washington, and my son is a sophomore undergraduate there, so I now have a second excuse to go up there and visit him anytime I want. Also meeting Selfie and, of course, Sarah, and we were introduced in December, and Sarah not only saw the importance of this and stepped up, but it was important to all of us that the official launch, aside from the paperwork, which we're doing today, really was in 2015, so we can say that it belonged to the anniversary year of the genocide. The way I got into this, the gene for familial Mediterranean fever was actually discovered by some geneticists at our affiliated hospital, Cedars-Sinai, but they had no interest in doing clinical testing for it, so they passed it on to us. And I'm the founder and longtime director of the Molecular Diagnostic Laboratories at UCLA, and we became the first place in the country, if not the world, to offer genetic testing to help make the diagnosis for familial Mediterranean fever. And then about 15 years ago, our FMF clinic, which is directed by Terry Getzug, a colleague of Eric's, and now I'm the co-director, Dr. Melenkoff, who was our former dean and founder of it, decided there ought to be an attending physician there who's a geneticist. And since I was already doing the testing and part of our clinical genetics group, I sort of got volunteered to go there. For those who don't know, familial Mediterranean fever is a recessive disease. It is found in various ethnic groups, but the carrier rate is highest in Armenians. It's as high as 1 in 5. It's the highest carrier rate I know of any recessive disease. Even sickle cell in Africa is 1 in 10. So it's been called the Armenian disease, or as I learned today, the Yerevan disease, which is the capital. And originally I thought, well, how can you have a clinic that only has patients with one disease year after year? It's going to get so boring. But it didn't. It's a fascinating disease. Every patient's story is different. And best of all, I really got to know the Armenian community here in LA and regionally, because people visit us from many other places. And we see the adult patients in the clinic in the Division of Digestive Diseases, and then the pediatric patients I see in our clinical genetics. And I've learned that, well, for one thing, as Selpy knows, I'm Jewish, although not religious, but culturally Jewish. And I have discovered that the Jewish and Armenian peoples have so much in common, historically, culturally, emotionally. You know, they've both been through a genocide. They both have genetic diseases that are unique to them. What I've learned from working with the pediatric patients is that Armenian mothers are just like Jewish mothers. So I really feel such a close affinity. And,
I have 5 kids.
Yeah, exactly. And Selpy has already promised me that once this gets launched, there will be an opportunity to actually visit Armenia. So a big part of this, it's not just to study this one disease, it's really to do an Armenian genome project. And as Evgeny said, we feel this could be the genome of all the different ethnic ones on Earth you could choose that will be the richest as far as scientific knowledge. The genomes that have been best studied up till now are 2 national genomes, Iceland and Finland, because they have small populations, very homogeneous, they've been isolated, but they're not that interesting. They're fairly recent populations. They're Caucasian, Northern European. You know, they found a few rare genetic diseases that only they have, but that's about it. The Armenian population is so ancient and has been isolated the whole time. I think we're going to learn so much about anthropology, about human origins, migrations, and how diseases have cropped up. Why is the carrier rate 1 in 5? Does it have some benefit? You know, like sickle cell does in Africa. I think we'll learn all these things from this project. So I really want to thank Sarah for appreciating the interest in this. I think it will be well rewarded scientifically. I'll only end by saying, after I met you in December and learned about your book, which is the memoirs of your father, who was a genocide survivor, I went on Amazon to get it. The book is in 8 languages, but the only new copy they had in English was $350. So I ordered a used copy, which is in perfect condition, and I'll pass it around. I was going to have you inscribe it for me, but actually, since it's used, it already has an inscription for me. So you'll have to see this. Unfortunately, it's not to me. It's to the University of Uppsala, Sweden. So you must have known someone in Sweden, and somehow it ended up on Amazon. I don't know. Anyway, thank you
Describe it
again.
again.
Pass this in. Yeah, you can sign it again.
That may be even more valuable.
It may be more valuable. So thank you so much.
Dr. Israelian, can I ask you to say a few words?
Yeah, thank you, Tom. Thank you to everybody. It's an honor to be here, and I'm so appreciative of Ms. Chichin's gift and for launching, I think, what is going to be something momentous, as what Dr. Brody mentioned. The Division of Digestive Diseases has a long history of studying FMF, caring for patients with FMF, but I think it's just the beginning despite all of that. And I think we have a very unique opportunity, and it's, you know, as a chief, it fills me with a great sense of pride and seeing, you know, kind of the UCLA community family here unite, and I think it's a great beginning. And thank you again to Sarah. I think it's incumbent upon us to kind of take things to another level, both for patient care, for research, and of course, understanding the genetic background of the Armenian people.
Thanks, Eric. And Vice Chancellor Karagosian, would you say a few words, please?
Sure. I won't say very much other than to indicate that this is yet another example of UCLA's very strong commitment to